Welcome to another episode of Founder Exchange. My guest this week is Dr. Nick Mohindra, who's the founder and CEO of Oralift. Oralift is a truly revolutionary dental plus cosmetic product that I'm really excited to have him share about. So welcome to the show, Doctor.
Thanks a lot, Vibhu. It's nice to talk to you. Fire any questions at me, and let's see if I can answer them for you.
So first, just tell us what Oralift is.
Well, I was a dentist, and we used to use an appliance in the mouth to treat TMD symptoms, and over the years I developed.
What is TMD symptoms? Our audience is you can assume
All
is
right.
fairly uneducated about dental.
Symptoms are facial pain. A lot of people have a lot of symptoms associated with this joint, the TMJ, and they can suffer a lot of pain from this joint, which can give them headaches, migraines, facial pain. It can make life very difficult. It's a very difficult area of dentistry. And I was very interested in this. And I used to use an appliance called the pivot appliance, which we used to treat people with these patients. But I wasn't getting the 100% success that I thought I should be. And then over time, I developed a theory about how we can change people's faces. And then I developed the technique called the dental facelift. But the dental facelift involved making the teeth longer, making the height of the teeth longer, so raising your bite. And it was quite an invasive process. But all the time I was using this appliance to determine where to place the jaws. Then from that, I realized that the appliance alone was having an anti-aging effect on the face. And that's how the Oralift appliance came into being. And that was in the 1990s.
So just to summarize, there's a class of pain that people would come into your office with, and what you found was that the way that it was treated had this other side effect of giving someone a facelift without sort of any kind of surgical techniques. Is that
exactly? And that treatment has evolved into Oralift now.
Right. And so Oralift is a product that people can buy from you, right? And it's a customized product that sits in your. Yeah. Can you explain how it works?
Okay. It's a orthotic that fits on the lower teeth. So you mold it like a mouth guard, and it fits on the top of your bottom teeth. And what it does, it makes the jaw change its position and come to rest in a new position. And to be able to rest in a new position, the muscles of the face, the head and neck, and the swallowing muscles and the breathing muscles all have to adapt to this new position of the jaw. And it's this process of adaptation that causes all the anti-aging effects to take place.
And so when it's sitting in your mouth, does it change your behavior? Does it hurt? Can you talk?
You don't have to do anything. The facial muscles do everything for you. You don't need to talk. You don't need to eat. All you got to make sure is you don't bite on it. You keep your lips together and let the jaw rest in its new position.
And how long do people have to leave this in?
At the moment, the regime that we have tried and tested is they only need to wear it very short periods during daytime, in the morning and in the evening, maximum 1 hour at the most. But what we have found is that there are two different types of people. People who have got very tense muscles, and they find that they can't keep the appliance in the mouth even for a few minutes. So what this treatment does is it makes those facial muscles more relaxed and healthy. And they come to a stage eventually when they can wear it for an hour in the morning, an hour in the evening, or even
Right.
longer.
Right. But so I wear it for an hour a day. How long does it take for the facial muscles to kind of change um, and kind of
For you to be
permanently?
Yeah, for you to be able to notice something happening.
Right.
Now, this is one of the things that really amazed me. In orthodontics, we know facial muscles can adapt and let the jaw rest in a new position. But what I didn't realize is as soon as you put the appliance in the mouth, the facial muscles start to adapt. And sometimes patients can see results on their face after 10 minutes of wearing the appliance because there's
Really.
increased blood flow, muscle hypertrophy, some muscles increase in size, the extra blood flow to the head and neck. It sounds unbelievable, but our body is capable of so much that we don't know yet. And that's why the research element of this is very exciting.
Yeah. It strikes me that in the dental space, there's been the most innovation around kind of 3D printing and like shaping, and because there's been, with Invisalign and a lot of companies like that, there's been techniques to kind of mold things over time, and I think this is another approach on the face. And why is the mouth kind of the focus of a lot of innovation these days, and why do you think that
Well,
is?
I think it is because of the facial muscles. When a baby is being formed, the facial muscles and the heart muscles origin is from different cells than the rest of our body muscles. So these facial muscles, sorry, the phone. Uh, our facial muscles origin is different, and I think that's why the capability of the facial muscles to adapt and what they can do to regenerate tissues is far greater than our body muscles. We all know
Hmm.
the benefits of exercise, but the benefits from facial muscles are far greater.
Is there, just from an evolutionary perspective, why is that? Is there, what is it about the face that is so different from the rest of the
I
body?
think the face is so crucial for so many things, for eating, swallowing, breathing, expression, communication. So these facial muscles are really very critical
They're
for
precise, huh?
evolution of the species.
Right. Yeah, and you can do things with your, within our, when I'm talking, I think that the sophistication of every little movement here is just quite different than any other part on the body.
That's right. That's right.
Yeah.
In fact, I was talking to a professor once, and he said, "Do you know why the French look like French and the Germans look like Germans?" And I'd already worked that out because I'd been thinking on the same lines. And I said, "Yes, of course, it's because of the language. Because
Hmm.
the language, the way we move our facial muscles, can dictate how our face is forming."
Interesting. So, how early does it make sense to have this kind of treatment? Because you call it anti-aging, but I know that the origin of this is also to help people fix pain. Is this
Uh,
something where you do it from early on, like you would with, you know, braces?
Yes, we don't. The Oralift is regarded as a general wellness product by the FDA. So before we can claim any health benefits, we need to do a lot more research. But the
Understood.
cosmetic benefits, they should be started as soon as, well, people in their 20s are worried that their face is going to start aging, they're going to get wrinkles. So instead of going down the Botox route, I think they should start on this preventive medicine system. Uh, so really, it, any age from 20 onwards, and the beauty of it is that facial muscles respond no matter whether you are 20, 30, 40, 50, 60. My oldest patient when I was in practice was 82 years old, and we could see results on her.
Amazing. And you did, and I know you caught me here because I've had a couple of other founders in the kind of health tech space, and you didn't want to say that there are health benefits and that changes how you have to, those have to be validated by the FDA, right? But I mean, maybe in general, can you talk about your process for, because you can't say this, but I can, like, this was invented to, and I think the techniques behind it were invented to help people relieve pain and suffering. We don't know if this device, from a technical standpoint, the FDA won't allow companies to make those claims. But I noted on your website you talk about how the average time to actually get published research done on the health benefits, and I mean, in general, like innovation can be some of the things that are coming to market today might have been validated 20, 25 years ago. How do you think about that from a company building perspective, right? I mean, are you like, are you thinking like, are you imagining that this company will be here for 25, 50 years, and you plan to kind of do the clinical trials, do all the kind of work to see this out, or like how are you thinking about that in
I think
general?
that you've put it in a nutshell. I think this is going to last. It's lasted at 20 years. It was developed 20 years ago, and it's going to be the norm for the future. Just as we think of exercise as the best natural medicine, I think one day, with enough research behind it, we'll be able to show that facial muscles can give us even better results than normal exercise.
And you tell me about the company itself, the team. When was the company founded? How have you been building the company in general and the team? And have you raised capital? And what's that
Well,
context?
uh, the whole work started when I was in practice, when I was doing dentistry. And luckily for me, when you're doing groundbreaking stuff, which is you can't go to textbooks and look and say, how am I going to do this now? You've got to think on your feet all the time. And when you're dealing with facial aesthetics, the important part of that is treating the person. And luckily for me, my wife, who's a co-founder of Oralift, used to work with me in the practice. She's not a dentist. She was a teacher, and then she became a practice manager. And then she used to be in the practice with me. And she really played the role of the psychiatrist, looking after the patient's total being and not just what's happening to the face or to the teeth. And therefore, my wife has been crucial in the way this product has developed. So in our team now, we have got my wife and myself as the co-founders, and we've got technical people who've been helping with the app, and we've got people who are managing the online support system. So the team is starting to grow. It's still quite small, but it is growing.
And you retired from dentistry, I think you told me beforehand, 6 years
That's
ago,
that's
and
right. That's right.
you've
But
been
my
full.
passion is still Oralift, and therefore I really want to. I, I hope I'll be talking to you in another 20 years' time when Oralift will be at a much different level than it is today.
So I'll take you up on it. Sounds good. Yeah. What about the challenges of internationalization? Every country has its own kind of health codes and bureaus that need to be involved. Are you thinking about this internationally? What markets are you tackling first?
Uh, Luckily, because the FDA has regarded this as a general wellness product, most of the other countries tend to follow the regulatory systems set up by the FDA. So at the moment, we are just regarding as a general wellness product that can improve your health and make you look better. But when we do further research, then we'll develop a new version of the appliance, which we'll call Oralift Medi, which will then be designed for other health-related problems.
Gotcha. Okay. And when someone is signing up for this, do they require? I know it's a general wellness product, but I know on your site you also have optional appointments that people can take. Is there a benefit to consultation, or like what's your thinking about the kind of customer experience from start to finish?
I think the app we have developed has all the information. And if people take their time and study what's in the app, they'll find all the information they need. Sometimes they are eager to get on with the treatment and rush through the app, but never mind. We've still got all the information in the app. They can go back to it later. At our website, we've got a lot of information there as well.
Right. Okay.
Our case studies that we're doing, we've got a couple of case studies where the users have allowed us to use their live pictures. So we are following their journey as the treatment progresses.
Yeah, I saw that. And I'm certainly not an expert, and I looked at those and like my untrained eye, I struggled to see, and oftentimes you see, I mean, we've all been exposed to like before and after pictures, and there's like, the before picture is oftentimes like poorly lit and like unstaged, and then the after picture is like, someone in a studio with professional lighting, and like you're like, okay, that obviously looks good, but how like, do you actually have a guarantee on seeing results?
That's right.
Is that an aesthetic guarantee, like, or is it kind of a self-reported, like, yeah, this feels different to
No, no,
me,
no.
and yeah,
If they follow the program that we have set out and they follow the rules, that is, they don't suffer signs from overuse, and they do it for the 4 months, we can guarantee that there'll be changes that will be taking place. Now, these changes may not be what the person individually wants, but there will be changes taking place because the muscles are going to have that anti-aging effect on the face. I think one of the problems with photographs is, as you say, some are photoshopped and other things. The ones that you're seeing now are taken by the patient. I call them patients still, old habit, but
yeah,
the users themselves on their smartphones. So the lighting and everything is under their control, and we do ask them to standardize that as much as possible. But these are photographs in real time. And
right,
because they're not just a before and after, but a series of photographs, you can see how the face is gradually changing.
right. I was wondering if you had plans to introduce any sort of 3D modeling, because I would think if you could do a 3D photo
I
scan over
think
time, that would be like more, it would be more obvious. You could even compute the kind of deltas on the
I think
face,
that
right?
was the study that I did with Kings. We used 3D modeling for that study. And 3D photography is becoming so accessible now. You got the iPhone, which can take 3D images nowadays. So that is going to be our way forward. We are going to do another study very soon in July, hopefully, which will be on a larger number of people, but we'll use 3D imaging there. But the 3D imaging will become the norm in the future. So people will be able to use their smartphone, take a 3D image. We'll be able to superimpose those 3D images on each other, each image on the other, and be able to show the changes that are taking place.
Do you, do you personally use your own product?
Yes, everyone who works for the company has to use Oralift and experience it for themselves.
And you've noticed a difference on your facial
I've been
structure?
using it for 20 years.
Yeah.
And if I show you, if you saw my jawline from 20 years ago, I was starting to get those jowls forming, and that's firmed up, and it remained firmed over the last 20 years.
Nice. Do I need to do I,
Everyone needs Oralift. There's no one in this world who doesn't need Oralift.
yeah, yeah. Um, yeah, I mean, I want to reverse a bit because you have an interesting backstory we didn't really get into. Um, so you were born in India, but you kind of grew up in Kenya, and then moved to London. Tell me about that journey, but more importantly, how that kind of affected your thoughts on building
It
this
was
product.
my grandfather who moved to Kenya because that's the time when the British were there and they were building the railway, and he was
Hmm.
the station master as they were building the railway. And my parents moved eventually with my grandfather to Kenya, and all my brothers and sisters were born in Kenya. But then for a little while, they went back to India. I was born in India. But then at the age of 6, they decided to go back to Kenya. And I always thought of myself as a Kenyan. And then in
Is there a
60,
big Indian community in Kenya? I actually am not aware.
a lot of Indians in Kenya? Yes.
Hmm.
Yes, there's quite a large population in Kenya.
And it's all as
Uh,
a result of the kind of pre-independence. Um,
well, it was from the time that they built the railway. They needed a lot of labor, and they brought a lot of Indians from India to come and help build the railway in Kenya. And then a lot of them settled down there, started businesses,
right.
families, and came along. And, so there's quite a large business community in Kenya of
And then
Indians.
you moved to the UK.
Yes. My eldest sister and brother, they'd studied in London. Uh, and when it came to my turn, my dad also said, "What do you want to do?" And my sister, oh, there's a good story about my sister. Can I diverge a little bit and
Go
tell you
ahead.
about her?
Yeah.
My sister is an optometrist. Or, well, she's retired as well now. And she did her optometry in UK. And when I wanted to do medicine, she said to me, "Have you thought about dentistry? It's a much easier life." And I said, "No, I've never thought about dentistry." And she's the one who introduced me to dentistry. But she moved to uh, eventually to United States, and she lives in Boston. And if you Google her name and say Mohindra technique, she also pioneered a new way of treating eyes. And therefore, this sort of invention in our family seems to have carried down. She invented the Mohindra technique, and I've got the Oralift now going at the other end.
That's big expectations for your children to continue to fix our
They've
faces.
got to keep up the trend. Sorry, I was in, yeah. So I studied in Scotland, in Edinburgh, and then I practiced in London, my dentistry, South Wales. And because of my son's, he got diagnosed with kidney problems at the age of 20 months. And so we had to move from South Wales to London because at that time, dialysis was only done for children in the London region. So I moved down to London. And as soon as we moved to the London area, he went into remission and didn't need a transplant till he was 29. But that was when he was 5, and that was in 1975. And I think that had an influence on me and to how I did my dentistry, and eventually led to this Oralift device.
How have your colleagues in the field? What do they think about the product, and how's that gone?
Uh, and that's very interesting. Oralift is quite disruptive in the way we practice dentistry at the moment. A lot of people feel that the bite, the way our teeth meet together, is crucial to everything. We are dentists. We think about teeth, and the way they meet together is the most important thing. And with Oralift, we are trying to teach that tooth contact is not necessary. When we chew our food, teeth don't meet because teeth help to squash the food, but they don't come into contact. There's a mechanism that separates the jaws before they come into contact. When we swallow in a relaxed manner, teeth don't meet. Now, if you take that to its conclusion, if teeth don't meet, then bite is not very important. And if bite isn't very important, why do we keep correcting bites? We know lots of people who have got awful bites and they manage life without any problems. So, in a nutshell, dentists are a little bit wary of my philosophy.
Yeah,
But
that's an interesting
like
challenge.
any new disruptive technology, it takes time for it to become the norm. And
Right.
I am here to, my efforts are going to be to make this the norm. It's a big challenge.
Where do you see this heading? I'm sure the product as is not the only thing that you've imagined, and this is, we're going to wrap it up after this. And what's the last? What are, yeah, where does this go? And
Okay.
yeah, tell
With
me.
further research, I want to show that anyone who has, just like exercise is supposed to be good for all sorts of diseases, I'm sure there will come a day when we'll be able to say that wearing this Oralift device is not just a beauty device, but it's a health device as well. And when do we get to that phase? When do we start to be able to claim that? I hope very soon with further research.
I love that. So, uh, thank you so much for being on Founder Exchange. Um, I certainly learned a lot. I know our audience is going to really be interested in this product, and I think, I don't know if it's in the stores yet, but it will be soon. I look forward to showing people how this works. So thank you so much, Dr. Mohindra, Oralift founder and
You're
CEO,
welcome.
and we'll see
You're
you
welcome.
next week on another episode of Founder Exchange.